June is marked on the calendar as Men's Health Month, and not just a month to watch for diseases that are exclusive to men. Heart disease can strike all, of course. Dr. C.C. Lee is here to talk about this. He recently joined Mercy Medical Center as the director of the Cardiac, Thoracic, and Vascular Surgery Services, the medical director for that. First, welcome to the city. We appreciate your time for today.
Thank you very much, Chris.
And really, what's an emphasis for this month? And I know heart disease, obviously, that affects everybody, but for men to maybe have a little bit more advocacy in taking more control over what they need to watch for?
Sure. I mean, men in general tend not to care about their health issues.
Right.
It's usually, their spouse who manages, the health issues at home. And so they tend to neglect their health problems. And heart disease being the #1 killer in men in this country, it's very important that they stay attuned.
And it's so prevalent with that because, and I'd like to think that we're kind of getting away from that sense where men can just kind of ignore this and just, I'll rub some dirt on it, I'll be fine, or just ignore going to the doctor for something like this.
No, they can't, because according to the CDC, the Center Disease Center, states that, over 400,000 men's lives are affected yearly. That's 1 in 4 men who die of heart disease. And most of them die suddenly without knowing the fact that they have heart disease. So it's so important for them to be in tune with the potential problems of heart disease.
What can men do proactively for whether it's heart disease or really anything that could be a threat? I know once a man turns 40, then you watch for colon cancer screenings, and you just watch for other things. Maybe get your annual physical. Make sure you follow up on this. What should men do?
Well, in general, you got to control what you can control. I mean, if you have the gene for heart disease, there's nothing you can do about that. So things that you can control, like no smoking, good diet, daily exercise, walking, doing some type of activity 30 minutes daily, seeing your doctor on a regular basis. If you're on medication, make sure that you take your medications regularly. So those are the things that you can do.
Since you've come here, I understand, from Wisconsin, again, welcome to Iowa. Describe your new role here at Mercy Medical Center. What will you be doing then?
Well, I basically was identified to become the new heart surgeon at Mercy Medical Center. It's a new heart surgery program. Obviously, there's a lot of excitement for the patients who want their care at Mercy. Currently, if they need to have open heart surgery, they cannot have it at that facility. So as my new role as a medical director, we will develop a new heart surgery program inside the walls of Mercy Hospital.
And Dr. Lee, I can appreciate the irony, the coincidence here to try to tell men to do whatever they can to avoid heart surgery and heart disease. We like you, but maybe try to avoid seeing you unless it's absolutely necessary. Welcome to Iowa, and thanks again for your time.